All right, folks, I'd like to welcome you back. We're going to get cracking. Welcome back.
So I just want to, it's been very interesting and instructive, the first session, but can I just make a couple of comments? Can I remind us all in the room that we are the ARC? It's not me and Vicky and Caroline, it's all of us. And really what we're hoping for is positivity and constructive comments. We've presented a guidance here and a rough outline. It's a bit late in the day to make wholesale changes. And I'm just hoping that the atmosphere can be more positive and constructive, because what we need to be at the end of today is not let's start from scratch, but how do we build on what we've got, and who wants to get involved in which elements, and how we're going to sign up for this. Because that's really what I'm hoping you will come away from today with, is an enthusiasm for the programme and some specific thoughts about how you and your organisation can get behind this, and which bits you can send us letters of collaboration on, which we will also need going forwards. So we've flipped what we're doing, which you're going to hear about now.
It does lead seamlessly in. So what we're going to ask you now is to let us know what has worked well. What has worked well in CLAHRC or ARC, which you would like to see through into ARC2 if it's not in the document already, or if it is in the document already, say, oh, it's fantastic. So we would love to hear from you to do that. I'm going to let you use those 3 words. They'll start popping up here. And then we're going to have a really rich conversation about this with the panel in the room, online. Let's really get digging into this a bit. We've got until lunchtime to do this. So I think there should be a chance for everybody to input. So the poll is up. What 3 words would you use? Great. And it can be 3, words. Doesn't have to be a sentence of 3.
Racism.
Fab. Right, keep them coming. There's loads of you online. Loads of you in the room. What themes are you seeing emerging?
Collaboration.
Yeah. Yep.
Races, internships, capacity building.
Yeah, public advisors, public voice.
Health and equalities focus.
Yeah.
External grants. Co-creating.
I also think if this is things that have worked well in CLAHRC and ARC, it's quite nice that a lot of these feature in the guidance for ARC too. So that's a good place to start.
Yeah. So you feel this represents well what you're taking forward? Any surprises?
Yeah, I think I don't know whether colleagues have looked at the back of the room, but that is a fraction of the outputs of the ARC, which is, I think, around 500 peer-reviewed papers in 5 years. I don't think I think we often forget just how much the ARC has leveraged in terms of, and supported the leverage of, in terms of external investment, which is over 70 million now. That are grants that we're either directly leading on or involved in or supporting. And the huge number of written outputs that have come from this, and the implementation projects that have arisen from the ARC, I think we often forget, because there's so much of it, become blasé about it. Let's not forget for that small investment, and it is a small investment on, if you think, the ARCs as a whole, for what one biomedical research collaborative gets, has produced more papers than all of the BRCs put together. And I think we often forget just how cost-effective ARCs are in delivering what they've got to do, and it's a huge ask. And don't underestimate the ask in this guidance. It's a huge ask. It sounds like a lot of money, 16.8 million, but it isn't, when you see all of the different elements of work that we have to do. So let's be positive about all the fantastic things that we have achieved and build on it, but crafted to meet the new emphases and the ask and the greater guidance from the centre as to what ARC2 should be doing than perhaps ARC currently have.
Anybody want to comment in the room, comment online? What's gone really well? How did you know? What? Yes, hello, right.
Dorcas.
Ruth's on her way. Hold fire for the mic.
Thank you so much, Dorcas, Public Advisor. What I've missed a lot is knowledge exchange in this last ARC. During the CLAHRC, we used to have knowledge exchange from the practitioners. They will come and speak to us about this research we've done, the impact they've had, and then they speak to us. And I think that was a great way of using our partners. So I hope we can put that into Act 2. Thank you.
Thank you. Anyone else? What's worked well? What would you love to see more of? Anything you took from the CLAHRC? Anyone online? Sian, is anybody?
Carol has said, if I can have 4 words.
Carol, you can.
Linked to races and internships and PhDs, equity across the NHS providers to be involved with every NHS trust, having a link support person.
Thank you.
Was that a question?
No comment.
Because people were looking at me, I thought, expectantly, I thought,
I liked it that people said they liked ARCFESTs and they wanted to keep those.
good.
I liked hearts, minds and fun. That was good. Oh, yes, great. He's behind you.
Yeah, indeed.
Alan.
Twice. Yeah, you said earlier, Mark, that there'll be fewer larger projects. People have written what I've been thinking, that was some of the things that were really good, PhDs and internships and so on. Does this mean then we won't be
No. Those are capacity building, that's a separate stream. We're talking about what we fund and what we do in terms of our research. So it's specifically said in the bid that they're not expecting to see plans for a large number of small pilot and feasibility projects, which they think we've done too much of, and they now want us to push on from that to build the nationally relevant evidence
but
and
we're still
implement
doing
that into
PhDs
practice. But the
so on.
PhDs and the internships, they will still be in.
But we would be, as we do now, trying to encourage those things to be member priorities, so that we get engagement of the member organisation for the internships, whether it's for a races, a small pilot project, whatever. And then what we would like to do more of is taking those things forward. So in one of the drop-in sessions, East Lancs explained that how fundamental the internship had been to the development of some programmatic research at their end, because they've had, done that preliminary work, been supported in doing another bit of work, and then it's gone on to something bigger. And I think that's part of what we'd like to do, is to help those PhD studentships and the internships to move forward as programmatic research in a particular area that is focused on something that the organisation where that person's come from wants to change.
Yeah. So I think just to answer that question in a slightly different way, Alan, a key criterion of PhD proposals that get put forward either from within the ARC or from students coming to us and saying, I'd really like to do this. And the same with internships is, where does it sit against our priorities? And it would have to do that before it went further. And as just to build on what Caroline was saying, there will still be pilots and feasibility, but they'll be done in partnership with the member organisations to build the bid that then comes out of that. It would be part of a bigger project, not a standalone. We've done that feasibility, now we step away and go and do something else. It has to have the follow through, unless we can say we started off on a big project and now we know that's not going to work, or it's not the right solution, so we've stopped it. But then we produce the evidence to say, and it doesn't work for the following reasons. That's how I see, that's my interpretation of what I think that means. Not that you don't have to do the preliminary work, but it's in and of itself, it is not enough. It has to go on to the bigger thing, either with ourselves or with other ARCs.
Because you want all of it to have an impact in the end. So that's where we need to be going with everything.
And one thing we've always tried to do with all of our internships, and it was true in the CLAHRC, and Jane's back here for those of you who haven't noticed, and our PhDs is an implementation guide at the end. So the so what, now what does all this mean, and why does it matter, and what do we do with it? And that has to be at the core of what we do. Oh, Jane's hand up.
Hello, thank you. I think one of the things that has worked or can work really well in CLAHRC and ARC, North West Coast, is the way that we have mobilised knowledge from everyone that's relevant to that particular subject topic. So we've brought together, I mean, it's not been perfect, obviously, but we've strived to bring together the voice of the academics, the voice of the practitioners, and the voice of the public for each of the projects that we've done. It's worked better in some instances than others, but I think that's a real model that you can articulate in the bid to say, this is how we work, this is how we mobilise knowledge right from the very beginning, not just the thing at the end where you've got a paper that needs disseminating. Thank you.
Yeah, I think I'd like to think we've done that with the round tables as well, where we've got the different contributing organisations and key stakeholders together to think about what's happening, what's planned for the future, and what impact those things are having.
Just hold on for the mic, otherwise we're going to miss it.
I guess it's just when the bid goes in, making sure that that's really clearly articulated as to that's the way that we work, that you work.
There's been some comments online and to some extent in the room about the number of themes and how we do that. And themes are expensive, and they can also over-dilute. And I've noticed from the proposals I have seen is actually we probably have one more theme than the other ARCs that I've seen that only have 4. And so, you know, the ICB might have 9 themes, but we can't have 9 themes. They're only allowed 7. And I think actually sensibly we shouldn't have more than 5. And they need to be demonstrate their focus within how we describe them, but they need to have an inclusivity in their stretch across the priorities is where we are at the moment in the structure that we put together. And it's riding 2 horses of how specific and focused we are, but also how we make sense to those organisations and those people within those organisations and the public, that makes sense to them and they know what it is we're doing when they look at the titles and what we do. So that's then they are different expectations from different audiences. So, but the audience that we have to convince at this stage is the ARC NIHR panel. And so those themes will be very short in terms of title at this stage. If we're funded, they may have more words underpinning them so that it makes sense to the wider audience. That's, I think, the guidance I've had from senior colleagues so far.
It's about showing innovation as well. So, you know, we know the NIHR centrally loved Clarissa's Dimension Inequalities board game. They wanted the story on that. It's about ARCs coming up with ideas as well to communicate things, things that are real, things that they can feel, in addition to the publications, in addition to having the names on of the collaboration and the advisors. And I think there's lots of things in ARC that people zoom in as to what's interest to them, but we're actually doing a lot more in all of those different areas, but they zoom into them. So things like the races, we know our members get those questions and work with the teams on them, which do make a difference. We're investing in their work with us already. So there is lots of things we've done that we can build on and that are good, but we're sometimes in the ARC, we only look at our own little area.
Mm-hmm.
So there's actually a question on the chat, the impact case studies question. How many impact case studies have been developed from health higher education institutions towards the research excellence framework resulting from ARC? So impact case studies is one of the ways that universities demonstrate how they've made a difference to society and made change from the research activity that they've been undertaking, and they're called impact case studies, and they're part of the ways that every just less than 10 years nationally all universities are judged in terms of their excellence and their value for money. So just to try and translate that into sort of non-jargon, if I hope I've succeeded in doing that. Now, somebody said to me a couple of weeks ago, none, but I've since found out that isn't true.
That isn't true.
Definitely isn't true, and lots of universities have actually put ARC and CLAHRC impacts down for their impact case studies and have scored highly on them, and I'm hoping that we will be able to do that as well. But it's about demonstrating that how working collaboratively together and bringing those higher education institutions together, we've made a real difference at population level and organisational level, and I hope we can demonstrate that. We've got lots of case studies that we send through to NHR that they send on to the Treasury, and that's, if I don't know whether anybody, we did circulate it, but there was a national report on ARCs about a year ago, and that was extremely positive, and that's why we're having ARC2, and that's why there's additional investment into ARC2. It's now seen by NHR as one of its better value for money investments because it makes such a difference in a relatively short time. So we're just being asked, well, we're not just, we're being asked to do more of that more often.
Yeah, I mean, I read some of the comments and they've gone by the time I've made a note, but there was one, somebody's commented about collaborating with other ARCs across the country and how valuable that has been, and will that be continuing in ARC2? They hope it will. I think that's absolutely going to be key. And again, from speaking to ARC colleagues from across the country, I think we're all starting to look at what our sort of emerging themes are going to be and work out where we can sort of align with each other to take those forward and do more work. And I think mental health was one of those where we haven't specifically mentioned it as a theme on its own. There was a comment on that before, but other ARCs have done the same in that it underpins quite a lot of the topics that they're coming up with, because it's just sort of embedded in most things. And there was another comment as well. Again, it's gone. Somebody had put what will happen with sort of developing public advisors if we're going to refocus to participants being included in research and widening that. I think it's doing both. I think there's the public advisors is one strand of that. For some aspects of work, it might be needing to reach out to people that we wouldn't normally reach out with, and it's using our networks and communities to link in with those and make sure we get that diversity and that representation, depending what we're doing. And I think that's, again, not doing it just as us with ARC, because I know Other people like the research delivery networks are doing things on that. Other partners within the research system are doing something similar. So it's how can we do it together again so the message isn't confusing, and how somebody might want to link in with us. It might not be something that we're doing if they just, I don't know, they maybe want to comment on something or take part in a focus group, but we might know somebody else who's doing that offer in the system.
Great. Sian, is there anybody chomping at the bit to speak to us online, or any comments you want to share?
Vicky addressed Jamie's about the CLAHRC work, and so I think that was on.
Great. Brilliant.
Yeah, I think in terms of cross-ARC working, we've also had cross-ARC internships. So one of the things that Mark mentioned earlier is about having the academic expertise to support some particular areas. And so that's something that we've done. The other ARCers provided the internship opportunity, but we've allowed them to link in with our ARC's academic expertise and courses. So we would like to do that more, I think.
Just want to, just before they disappear, just address some of the comments online. So it seemed to be too many objectives and some of the themes, yes, but because we were trying to capture some of the areas. But as the theme proposals are written, there is an expectation, and it's in the guidance, that we will have what are called SMART objectives, and they'll be short, medium and longer term. So you will see that those broad points that are made in the document that you've got will be focused down into deliverables, short, medium and long-term objectives. And part of the reason for today is to get that feedback from you about the ones that you and your organisation really want to get behind, because there's no point putting objectives and ideas down in the proposal that our member organisations aren't in sufficient numbers willing to put their efforts behind and their collaboration behind, because then they won't happen. So that's a really important part of today and up until Friday, is we really are keen on doing this. This is something that we're doing in our organisation, and will still be doing in 2025, 26, and we really want to see that as part of what we're doing. Someone says the last 5 themes of the ICB beautifully worded. I think, probably the person that wrote them. Could they tell us which ICB and which last 5 themes they mean, please? And then we can pick up on that, because there's 2 ICBs. I think workforce theme is intended to be called a cross-cutting theme, as opposed to don't be fooled by the diagram. There are themes that are themes, and themes that are cross-cutting themes. And at the moment, I'm expecting, Ellen and I are still discussing this and others, that the public health and prevention is cross-cutting, because we always have to think about prevention. So maybe not all of it, but elements of it will be informing all of our work. And workforce, because we're talking about different ways of working, different systems, different organisational systems, that involves workforce, and therefore elements of the expertise in the workforce theme will be relevant across all of the themes. That's what it means. It doesn't mean that we do everything. It means that picking up on that way of thinking and that way of working will be relevant to all of the themes. That's why they would be called cross-cutting. So I imagine that probably 2 of the 5, at the moment in my head at least, might be.
I just wanted to pick up, there's a comment about, we've talked about the Coran quite a lot. We've mentioned it this morning, we've name-checked it, we've said we really loved it. But I'm just wondering if people in the room and if people online know what Coran is, and I'm just going to gaze across the room and look at Paula and Joe.
Let's get some emojis online if they can comment, thumb up.
Did you want to just explain what it is? Because I'm just thinking not everybody might know, especially
Jana says we work to time. I'll be here till next Friday.
You've got 27
minutes to explain it, so dig deep.
And I did put that comment, so whoever put that comment on, thank you very much. There's been quite a lot of talk in the round and on the chat about fostering relationships outside of academic institutions, broadening the remit for third sector to get involved, and strengthening and further developing the public voice. We've had a community research and engagement network, that's an acronym for CLAHRC, in the CLAHRC and the ARC for the last 8 years. And that's how bloody long it's taken to try and get to a place where we're at now, where some people in the room might know about us, others might not. I don't know what comments have been made about the Coran, but certainly from my perspective, the intention was that the Coran was a network that could be responsive to the needs of, in the main, those not routinely involved in research. So Joe's here, I've seen Jan, I've spanned Jan, spied Jan, and you two will obviously have a voice in that. So at the moment, the Coran has got a leadership group that is trying to be representative of our vast geography. So it's representing the third sector voice around that participation, that research inclusion that we've talked about, that engagement and involvement of those people that the VCFSE sector, the third sector, represent in their community. So we very much look to the sector to be the eyes and ears and voice supportive of what is going on in local places in order to influence our priority setting for research. At the moment, the Coran, historically it was established with the manager. We do not have one in post at the moment. So although it's been talked about quite a lot in ARC2, there's absolutely a pitch about what we're going to do for the next 12 months around the Coran and how we can sort of further explore its reach and what it does in terms of that research inclusion agenda. I very much see it as being the conduit between elements of the NHR infrastructure. So Julie from the RDN sits on our leadership group as well. We work very closely with the Research Support Service. We work with local authorities. We work with the third sector. In order to try and cultivate a narrative that's about what's happening in the communities that we serve across Lancs and South Cumbria. So a massive undertaking. Where I would suggest our challenge is, and maybe something that's not worked as well, is our connections to researchers and academics. So people often talk about we need to speak to the voices of people with lived experience. Our challenge in getting that community research and engagement into participation in research is not the people in the community who want to get involved, it's our researcher colleagues who often, I'm going to say it, see this element as tokenistic, last thing to do. We've already got our pitch, we just need some people to say, yes, we can do, no, we can't. So my thing would be the Community Research Engagement Network is absolutely something we need in ARC2. But, you know, we've curated, we've evolved, we've strengthened, we've lost bits. There's an opportunity, Vicky, you spoke about the front door. There's an opportunity for in my opinion, that the Community Research and Engagement Network can be that front door to people who want to get involved in research in our communities, and in our organisations. We already do it anyway. We work with the Health Innovation Network, we work with the RDN, we work with RSS. That's what the network, the Coran network's been able to do.
Paula, while you're just saying that, there's been a plea that we reduce the amount of acronyms, and then you just did a whole sentence of some letters.
Didn't know what I said. So, RDN, we've already talked about that already. Research Development Network, another bit of our
Delivery.
Infrastructure offer.
Delivery.
North West Coast. RSS, Research Support Service, again, another bit of the NHR infrastructure. I'll throw a few more out there. As part of that broader NHR offer, which we've all talked about, you know, reducing duplication, Mark suggested we've not got a lot of money, but NHR's putting loads of investment in the North West Coast, so we need to pool what we've got. We've got HDRCs, another one, Health Determinants Research Collaborations. I'm going to name check Liz now. Liz Harper is one of our LARPs, Local Authority Practitioner Researchers, another NHR investment in the North West Coast. So we've got loads of investment. It's about the how we align, how we curate, how we collaborate and coalesce to ensure that the voice of the communities, of people with lived experience, helps shape our applied research and implementation. And I think the Coran, in addition to all the other networks that we know go on, we've got Public Health Network, CHAMPS in Cheshire and Mersey, really strong, you know, would want a research voice, I would argue, probably already doing it. So we need to think about how we network and how we matrix work in order to utilise our resources more efficiently.
Thank you. Brilliant. Right. We're going online, then we'll come to...
So can I pick up I now see what you meant by the 5. It's on page 7 of the document. It's starting well, living well, working well, ageing well and dying well, or health and care across the life course. But that's, after various discussions, is not in ARC2. It was felt to be too broad. It was actually quite hard to deliver as one thing. So rightly or wrongly, and this is where that feedback's really important today, because it's a major choice, we took it out because we thought it was, although really important, it was too diffuse. So we felt that the key would be to have a separate theme that was about children and young people and maternal women's health. But the women's bit was taken out to shorten it so that for the funding, but it would obviously be broader than that. But not adults living well in that sense, because that's felt to be in public health and prevention and in workforce, and not aging well because that's thought to be in the long-term conditions and the social care. So that's what all of those elements are included, but not as described here, because they are part of other themes, which hopefully will become clear to you and to the panel when they see the description of what those themes will be focusing on. So that's what's lying behind that. We hope all of these 9 are included in the themes that we have, but at the moment they're not described in the way they're described here. Ben.
Hang on, let's get a mic to. Is there also something about the way they're themed is how the NIHR are saying them, so that you use the same words? No. Ben.
Pick up on those. So what we've done is to summarise the 2 strategies of the 2 integrated care systems that cover our patch. Those 2 strategies have about 25 different priorities in them. I've tried to summarise them with 9 bullet points, but those are not 9 things that.
Yeah.
And everything, all the objectives in those themes basically are reflected in the 2 integrated care strategies that cover the whole of the Northwest Coast, because our members have basically been through a lengthy process with all the NHS organisations and all the local authorities in defining their priorities and coming up with them and putting them in their strategies. So we need to reflect what is included in those strategies.
Yeah, so these 9 themes are us showing our homework, are working out to come up with the answer that we produced in the diagram.
We're going to go online.
Yeah, so Nicola said, I think it would be good to have an equivalent column to hear the voices of the ICB and the population health teams or other organisations to feed into other themes. And then, Shakila, would you like to unmute yourself and give your view?
Yeah, a quick comment. You know, the starting well, I think I can understand now why maternity is sitting with child and young people, because it's seen as giving the best start in life and in utero. But the woman is not just a vessel for the baby. And I think that is why, if this goes for peer review, and if somebody looks at women's health, that would really annoy them. And every single person whom we've seen saying, why is that? I can understand from a starting well perspective, but this is things happen to the woman during pregnancy that has a lifelong implication in the long-term health. So that is this uneasiness in maternity sitting with calling child and young people's health, and I just wanted something to think about. It's not an easy task we have in front of it, but I just want to highlight that we need to really square that circle, because it's not just starting well, it's a whole host of things.
I understand that, but the comeback was, what about men's health? Because men have shorter healthy life expectancies and a shorter life expectancy than women, and also suffer health inequalities.
Yeah, but women live longer in ill health.
I'm just telling you what I was told. Don't shoot the messenger. I'm telling you what the feedback was.
Yeah, but I think...
so if we have women's health, we have to have men's health.
Yeah, the whole inequalities, that's why women's health is sitting there, Mark.
Well, if you look at our population, Blackpool's got the lowest male life expectancy in the whole of the United Kingdom. So if we don't have men's health, but we have women's health, there will be people that will be saying at the panel, where is men's health in this? So, rightly or wrongly, the judgment was made that to only highlight women's health, and don't shoot the messenger, okay? This was the thinking behind why it's not in there as a separate theme and as a single statement.
Yeah, the priority for NIHR is women's health. Department of Health and Social Care, it's women's health.
It's one of the priorities, yes.
Health of women, not reproductive health. That women are disproportionately, differently, and specifically affected, less funded. And there's a whole, reducing inequality says 1 trillion per year. and there's a whole McKinsey report on this. So I just want to highlight this from a funder's perspective. They won't look at it from men's health and women's health. They will go along the fact that women's health has been prioritized. And I don't want to sit here as a women's health researcher. That's not where I'm coming from at all. It's just to maximize our chances when it goes to the panel.
Okay, thank you.
Joe's been waiting patiently.
Yes.
Thank you. I'm sorry to interrupt this conversation, but I'm gonna. Just coming back to the Coran for a minute, I think Paula gave a really good rundown of it, but there was one thing that was missing, which is that there is a huge amount of research goes on in the voluntary sector, and it is completely invisible in our research landscape. I'm not talking about King's, what's it called? The King's Fund. I'm not talking about that. I'm talking about your regional and local voluntary sector organisations who have to research in order to get funding, and they have to report in the evaluation on that. And I think it's an area that we could absolutely unlock as an ARC. The other thing is that just on Mark's question earlier about the Start Well, Live Well and all that, having been in part of the Integrated Care Partnership in Lancashire and South Cumbria, I agree that it is too diffuse. There's not enough there to grab hold of and move forward. Thank you.
Yes.
Okay, so I do want to go back to the women's health one, sorry, and to support what Shakila said. And I think just pragmatically, we also have a Women of the North report, which shows how disadvantaged women are in the north of the country, particularly the northeast, but then the northwest, the most disadvantaged in the country. So the call has women's health in it. There's a women's health strategy that's come out from the last government, probably be supported by this government. And we have a report saying that women's health in the north of the country is one of the worst in the country. So it does seem rather perverse to not put an emphasis on that. And I would also say, in terms of the current theme, children, young people and maternal health, a bit like in the Starting Well, where the brackets are child health, again, to emphasise Shakila's point, maternity is a lot more than just producing a baby. It is all of that whole thing that's both about goes into the maternity episode, but then out of the maternity episode into the longer term. And I think to have a women's health stream that has maternity strongly in it with a separate child health stream would be much more powerful in terms of where we go forward from here. And I also believe many other ARCs are doing the same thing.
Thank you. Yeah, he's just there with the mic.
I wonder whether this is an issue about how we're articulating our approach to inequality and intersectionality, because I'm an inequalities researcher and I'm interested in women's health. I would also say that men's health in our region is particularly
speak up
poor.
a bit.
Yeah, sorry. Despite talking about technology, I'm not very good with microphones. But anyway, I'm not sure. I think really everything we do is about inequalities. Like everything. I mean, I think you could just add the word inequality to the end of every single one of those themes and then articulate better what we mean by tackling inequalities, and start with women's health and children's health and health across life course, and pick up all of that stuff and the intersectionalities, which of course are really important. I just think we are interested in this. I think we are researching this. I just don't think it's necessarily prominent enough. I guess, I mean, it's been put in public involvement, inclusion, engagement, equality and diversity, and it's right to have those things together, but I think maybe bump it up the agenda a little bit in how it's presented. And I'm a man of a certain age, but I did my PhD was on discrimination against girls and women, so I do have an interest.
Great, thank you. We're just going to go online.
Yeah, so Sarah Rogers has written, unlocking research in the voluntary sector. I agree with this. We could fund projects and join up with these across the North West Coast with researchers, including training for this sector and their public members. Would this fit into the ARC 2?
Sorry, I can't see that one. Oh, there we go.
It's on the...
There it is.
Yeah, it's come up now.
To your left.
Well, I mean, the finesse there is how that feeds into those bigger research questions. and how we maybe talk to those organisations about collecting data in a systematic way that is comparable across the organisations, because my suspicion is there are hundreds, if not thousands, of little projects within an organisation that speak to that organisation, but don't necessarily speak to a larger question or a larger database that we could then tap into. So I think talking to the VCFSE sector about how they can maybe come up with a common data set or some common collection and ideas would be worthwhile, very much so, because it does tap into that wider community and about maybe co-developing a way of supporting those organisations to collect data in a systematic way using relatively robust research approaches to get to hear those voices and to have reliable data that reflects their activity and reflects those populations would be really valuable. I could see Ben was getting agitated to want to say something at the back, because that's where Ben, I think, has a lot of...
I will have Ben reply and then we'll come straight to you. Is that okay? Don't look at me like that.
Yeah, and there's one here as well.
And then here. Okay, let's go, because we've got 10 minutes.
I was actually going to make a completely different point, I think. Which...
Oh, sorry, well, then give it back.
No. Am I going to get fired? I don't know. She should go. She's first.
Mine's just a quick comment that we're getting too specific when we're talking about men's health, women's health. I don't think that's actually what we're really should be discussing at the moment, because that's too drilled down. And I just think we've gone off point a little bit.
Okay, thank you. Hello.
Hi. Just very, very briefly as well. We can't use a personal characteristic that leads to health inequalities, such as gender, as a theme. That's just wrong. If there would be a women's health theme, again, there had to be a men's health theme as well. So gender needs to be incorporated as a characteristic that leads to inequalities throughout. So there's a comment against having women's health theme. That's my comment.
Thank you. Ben, would you like to?
Yeah, I suppose it's... Yeah, I mean, obviously many things are mentioned as priorities in the bid guidance, and, you know, we could have arguments all day about different kind of population groups. I mean, one of the things that comes out looking at all of the two integrated care strategies and the health and well-being strategies of our partners is that children and young people's health is a priority across our partners and our members. And you know, there's also a Child of the North report, and there's you know, major issues with child health across, and that is, you know, what is leading to many of the sort of lifelong inequalities. Sure. As has already been mentioned by others, some of these things need to be cutting across all of the work that we do, and it's probably not that useful to start dividing up into population groups and setting them against each other necessarily.
Okay, thank you. I'm just aware of time for this bit. Are there any you'd like to pull out from the comments you can see? Excuse me.
I think it is maternal. It's a sticking point. It was just putting that, you know, there has been quite a lot of thinking around this and some discussion, and you know, my point was unpopular, but I'm reflecting the point that was made to me by a number of very senior people. Including people who are going, you know, who are reflecting what the panel is likely to look for. So I'm not sure I accept that not having women's health would be negative at the panel. It's how we describe it in that theme, and I don't think we have the capacity to have a separate children and young people theme and a separate women's health theme. I don't think we have the funding or the critical mass to be able to do it in that way, which is why they're combined into one. It's you can keep looking at me, but I have to. It's a lot of money. We haven't got that much money, and if we want to invest in the themes to be able to deliver against what we're asking them to do, we have to have some critical mass within those theme teams, and we have to have the people coming forward to lead those themes and co-lead those themes. And at the moment, I think if we had a women's health theme, I'm not sure where children and young people would sit. and they would have another big hole that would be pointed out at the panel that we have got, which is why, on reflection, they were put into the same theme. And it's not just to say it's only about starting well, it's not to say it's only about maternity. Obviously, it's women before their reproductive time and afterwards, and through that, and families. I wanted a life course theme. I wanted to include this in that way, and was told that wouldn't work. So that's why we are where we are. And if you're telling me something different, I can go back and argue it. And these decisions are being made by the senior people in the HEIs.
Maybe it's about making the words more visible so that people feel like it's there. Maybe that's, I mean, to some extent, you can't make every single word.
It could be children, young people and women's health.
Well, that's what someone's just commented, like just clarifying it.
Yes.
So it's me again, sorry to come back on that, and I know this is a point of detail. I do think it's interesting that it's women that have raised the discussion has been raised on the back of this particular area, which is intriguing, I think. I think, Mark, we're now talking about having 3 themes, aren't we? If we take the other 2, if we take workforce and public health out, we've got 3 themes, which means the money, presumably, is spread more, there's more money.
Why are we taking public health?
I thought you said public health was going to be cross-cutting.
Yeah, but they're still themes. They're called a cross-cutting theme as opposed to a research theme.
Oh, I
but
see. So they're still staying there. Okay, that's
that becomes 5 themes, not 4.
Right, because I was just looking at, you've got the other cross-cutting themes.
Or 6 themes, potentially.
Yeah.
I can see.
I think to pick up on Caroline's point and what you said, Mark, as well, I do think that might help to actually be much more explicit, because at the moment the text under that heading is very child focused, which is fine. It's really good to have child health. Obviously, we want research in child health, but it is very focused on that and not on this whole continuum that we've just been discussing. So perhaps outside this meeting or somewhere, it's a question of finessing those words. But I think
that'll be up to the theme leads to do.
But who decides who the theme leads are, Mark?
Well, that's the HEIs, because it's their investments.
How is that decision reached?
It's the oversight committee and questions that have been going out, expressions of interest, knowing who's involved now, asking deans or EPVCs who in their organisation they think are the right people to lead this and co-lead this. Those questions are being asked. It's above my pay grade.
Okay. So how do we influence that decision, or what might...
Well, hopefully within the next few days they'll know who they are.
Okay.
I don't know yet. I've asked the question. I've got my ideas, but it can't be just down to me, and we can't do it as a voting collective. It has to be done by who the right people are felt to be academic champions for those themes across our universities, and they have to spread across the universities. Believe me, it's one of the hardest tasks I have of pulling this together, is determining who we are nominated as and agreed as the right leaders, and it will be done through that subcommittee, is my expectation.
Okay, so the call's gone out to all the relevant deans and all the
Yeah, absolutely.
Okay.
Back of the room. Hello.
Hi. I just think we're getting a bit bogged down in detail here, which is easy for me to say, potentially as a man, we've got a broad structure here, and we can weave in vertical things around child health and so on, but we've also got health inequalities of many varieties which take gender and many other characteristics into account. When we come to write the bid, we can make it very clear that we want to support and focus on women's health as a particular characteristic, but I don't think we need to have an ongoing bun fight about what we're calling the themes at the moment. That can go on in the background.
Absolutely.
We need to move on and discuss some of the issues around the bid.
Thanks, Tony. I've been writing a number of things, and the way I've been describing them as cross-cutting focus as opposed to cross-cutting theme, and obviously women's health is a cross-cutting focus. Men's health is a cross-cutting focus. But in terms of the themes and how we coalesce those organisations that are involved in early years, in maternity, in women's health, it's about building on the excellent work that Sue and Shaquila have done, pulling those ideas together within the current life course theme and taking it forward, but also thinking of the family as a unit, hence children and young people, because that's the way that populations often think, and the way that talking to people in local authorities and in commissioning groups, they also see the family as a unit, whatever that family might be and how it's constructed, as a way to invest and support through public health, through social care as required, which is why they are together. We could call it different things, we can come up with the right name, but that's why it's there as a focus. And I think I'm right in thinking it's not just unique to us that we're taking that approach in this ARC. I think it's done elsewhere.
Okay. I'm sorry.
Sorry, I know we've
I've got to do this.
detail.
It's lunchtime. Just before you go to eat some delicious food, when you come back, we are going to have switcherooed the tables a bit into staff, advisors and members. If you're online, you're going to go into breakout rooms of the same. You'll be facilitated and well looked after. So just a heads up, and we're going to be inviting you to bring us your ideas. This is your chance. Tell us how to be brilliant. Thank you. See you at 1:30.